What's worse, having type 1 diabetes or having type 2 diabetes? What about having double diabetes? Hello Nation. Today we're going to talk about double diabetes. What the heck is that? That's having type 1 and type 2 diabetes together in the same person. Now, type 1 diabetes is an autoimmune condition. It leads to destruction of the cells that secrete insulin in the pancreas. Every single person on this earth needs insulin therapy who have type 1 diabetes. And it's associated with other autoimmune conditions. Type 2 diabetes is a very hereditary condition, mutation in our genetic makeup, that leads to a condition called insulin resistance. In fact, when people are diagnosed with type 2 diabetes, there's plenty of insulin around. It just doesn't work that well. And people who have type 2 can be treated with lifestyle alone and a whole slew of oral medications. And when they stop working, they need insulin. So autoimmune associated with other autoimmune conditions, insulin resistance in type 2 associated with central obesity, high blood pressure, abnormal cholesterol. They're two completely different diseases. However, they have one thing in common for sure: high blood sugars. We're all blood brothers in a way. I think the best way to explain it is tell you about one of my patients. A friend of mine and my patient developed type 1 diabetes when he was 6 years old. As he was getting older, in his 20s, he went on an insulin pump. He eventually got a continuous glucose monitor. But it turned out that both his parents had type 2 diabetes. And we know that when both your parents have type 2, your chances of getting type 2 sometime during your lifetime is virtually 100%. So at the age of 40, 45, he started to develop central adiposity, started to develop weight problems in his abdominal area. He developed high blood pressure. He developed abnormal cholesterol levels. And we gave him a couple of the pills that we typically give people with type 2 diabetes just to see if that would help. And it helped his diabetes tremendously. And the other thing is his insulin requirements at the age of 40, 45 started to go up because this condition called insulin resistance makes the body resistant to the glucose lowering effects of insulin. So like many folks with type 2, you need much higher doses of insulin compared to folks with type 1 diabetes. So he has double diabetes. He's got type 1 and type 2 diabetes. And unfortunately, they're not mutually exclusive. Now, if you have both type 1 and type 2, it means that when you cheat on candy, you're allowed to double the cheating. So long, Nation.